L'Île-du-Prince-Édouard est une des premières provinces du Canada à introduire un système d'information sur l'utilisation des médicaments prescrits. Le principal objectif de ce système est la surveillance par le biais de l'enregistrement des médicaments. Par ailleurs, on a discuté avec ceux dont le travail va être facilité par l'introduction d'un système d'information sur les médicaments prescrits, à savoir avec des médecins et des pharmaciens. On les a interrogés sur la question de la mise à jour de ce système d'information et sur l'amélioration que son introduction va leur apporter.
Generally, when a patient is coming into me, I like to get a good history of the medications that they're using. As a physician, I have to rely a lot of the time on what the patient has to tell me, what record they may bring in. Some of them may bring in a little booklet, some of them bring them written down on a sheet of paper. Sometimes I have to call a pharmacy and find out what medications they are taking, what doses.
For patients with medical conditions such as Alzheimer's disease or even just older patients, this has become an increasing problem because these people are unable to give us a complete history themselves. In that situation, we have to rely on the alternative forms of medication history collecting, such as from the charts, from the hospital, perhaps from relatives or from the retail pharmacies.
As a pharmacist at the moment, without an electronic system to access, we often have to piece together information from multiple sources.
Notre enquête révèle que souvent, la transmission des données d'un dossier médical entre médecins et pharmaciens est problématique.
One problem I encountered recently, I had an agent come into the store for an elderly lady who required a prescription to be filled. When I asked the agent regarding drug allergies, she knew there had been a reaction in the past but could not recall the medication. She went to the car to speak with the elderly lady who, again, knew she had a severe reaction but was unsure of the medication. At that point, I called the outpatient department at the local hospital, spoke to them, and of course they had recorded no known drug allergy because she wasn't aware of which medication she had reacted to. That hospital then called a smaller hospital in her community who had recorded that she had a reaction to an unknown substance. The outpatient physician and myself decided to dispense the medication as written, and we also sold her some Benadryl in case there was a reaction. If the DIS had been implemented, it would have been as simple as looking at the profile and seeing the allergy that had been documented either by her regular pharmacy or her regular physician.
Under our system now, with the system of walk-in clinics, if you go in to see a doctor and you don't have your list of drugs that you're taking, nobody makes any effort to find out what you are taking.
Actuellement, on note un grand décalage entre les informations nécessaires pour qu'un médecin puisse nous aider et les informations dont il dispose. Les citoyens ont été interrogés sur les effets positifs qu'ils espèrent obtenir de la mise en place d'un système d'information sur les médicaments.
We think that in the emergency room in trauma situations, the electronic drug information system may save lives. The reason for this is sometimes these trauma patients come in and they're not able to give their own medication history in a complete form or at all. In that situation, time is of the essence, and we need that information as accurately and as completely as we can get it, including the drug allergies. In a trauma situation, access to drug information system may save lives.
I think it is good in that you only have one spot that you would have to go to rather than maybe calling 3 or 4 different pharmacies.
Our main goal is to help patients, so help them make better decisions, help them be more healthy, help them have the information they need to make good choices.
Un sujet qui semble préoccuper les citoyens est la confidentialité et la sécurité des informations sur les médicaments prescrits.
I'm fairly confident that whatever measures to keep the information secure have been taken, or at least are attempted to be taken.
Privacy and security of the health record is the #1 concern for patients, and the new drug information system on PEI addresses that in that it can give good reassurances to patients and physicians alike that the information contained within the record is private and access to it is limited to those who really need it.
Une autre préoccupation sérieuse est la toxicomanie et le trafic illicite des stupéfiants et d'autres médicaments.
Certainly prescription drug misuse is a major problem. Ask any police officer on the street how often they end up dealing with people who have substance abuse problems that are directly related to misuse of prescription drugs.
The prescription drugs that are being abused, not only in Charlottetown, throughout the region, and in fact probably right across the country, is things like OxyContin, Percocet, things of that nature.
The drug information system also gives us complete enough medication records and patient histories that we can keep abreast of those who may want to illegally have access to prescription medications, either for resale or for personal use or for distribution on the street. This is an issue that affects us all in every community in Canada.
La plupart des gens interrogés, à savoir les médecins, les pharmaciens, les citoyens, semblent avoir le même point de vue concernant la mise en place d'un système d'information sur les médicaments prescrits au niveau national.
It shouldn't be the way it is, and people's lives are in very much danger at certain times. Hopefully they will react to a positive way in the new idea that is coming about that somebody's trying to promote.
Pharmacists and other healthcare professionals have the goal in mind of making sure that patients have safety in their medication, in their health care, just in general making sure that they have a good quality of life.
The drug information system on PEI is a sister project or a parallel project to the electronic health record system or clinical information system, which is currently being built and set to go live later this year. These two projects are part of a grander scheme or a long-term strategy to integrate all of the health information system into one integrated health record, which is not only available for use across the province, but also is interoperable with other provinces' health information systems.
Le système d'information sur les médicaments est le premier pas vers la mise en place d'un système de base de données informatisé au niveau national. Ce système a beaucoup à offrir au secteur de la médecine. Les contribuables vont payer moins de taxes, les erreurs médicales vont être réduites et, plus important encore,